Thank you so much for joining us this afternoon. My name is Carolyn Ingram, and I'm the Plan President of Molina Healthcare of New Mexico. And I'm so excited to have all of you on our call today to talk about this very important topic. In addition to my role as leading the health plan in New Mexico, I also lead nationally for us the Molina Healthcare Charitable Foundation, which has chapters across the nation, 20 different chapters where we fund grants more at the community level in terms of making change. But one of the things that we also do is try to bring together communities to start talking about important issues around philanthropic work and around issues that might be affecting communities there. This is one of our ways that we can kind of contribute back in terms of sharing information from leaders across the state, but also making sure that we're getting new ideas out there and being able to start to explore new solutions as we look towards how we can build better and stronger communities through our foundation work at the community level. So today I'm very excited that we're going to be talking about this topic. As a native New Mexican, it's very important to me. I grew up obviously here in New Mexico, but I also raised both my children right here in New Mexico and helped my sisters as they raise their kids here as well. And understand quite personally, as I'm sure many of you do, some of the issues facing our youth across our state. Behavioral health has been an ongoing challenge and concern, not just in terms of our issues facing our youth, but across many spectrums in our state. And people have been working on this for many years to try to address it. But as we've been seeing issues come forth during COVID-19, we've seen that really New Mexico's adolescents were hit particularly hard with some of the pandemic and some of the things that happened there. Really at a formative time when our youth are learning to socialize, they have education that they're trying to achieve. They were removed from that school setting and forcing them away from some of their peers, some of that interaction, but also school resources that they had at their fingertips and were more easier to access. And as we move out of this stage of dealing with COVID-19 during the pandemic and really to a new stage, we see that this group continues to struggle with some of those lingering behaviors. A lot of our youth feel sadness, hopelessness. Some are abusing substances or self-harming. And so we really would like to try to make sure that we're putting up at the forefront this topic of discussion so we can see what is out there in terms of possibilities. I want to talk a little bit of context and give you some data in terms of what we're facing, and then I'll turn it over to some of our speakers and make sure we get them introduced today. But just to really think about these in terms of statistics for New Mexico, 40% of our New Mexico children are reporting feeling experience of sadness or hopelessness, which is a much higher trend than national trends. 50.7% of girls in New Mexico are more likely to experience this compared to 30% of boys. And children who are what we call marginalized, such as those who face homelessness or are LGBTQ youth, and students with disabilities are at a higher risk of mental health issues. A recent report found that in Bernalillo County alone, there was about 1,200 to 2,300 homeless youth on our streets. And then to cope with many of these issues, as you all know, students sometimes or youth sometimes turn to substance abuse or self-harm. And so we're really trying to see if there's a way that we can take a look at this and address it. On top of it, as you all know, we have a shortage of child and adolescent psychiatrists here. I don't need to tell you all that. All of you are healthcare leaders across the state, but we really have an ongoing issue where we've only got about 16 psychiatrists for every 100,000 kids here in New Mexico. So that brings me back to some of the foundation work and what we're trying to do here. Through the Molina Cares program and the Molina Cares Accord, we're really committed at trying to bridge some of those gaps and keep New Mexicans healthy and well and increase access to care for services in our community and to our state. And we know how critical it is to make sure we partner with stakeholders across the spectrum to get this done. Which brings me to today's panel. We have a lot of impressive experts on the phone today and on the webinar that are going to be able to talk with you about their role in terms of healthcare policy, what they've seen work, and try to start bringing some of that out. I want to make sure that we take some time, though, to listen to our keynote speaker. So I'm going to go ahead and turn it over to you, Senator Hemphill. Senator Hemphill was kind enough to join us today, obviously very busy with a lot of the work that she has going on around the state. But for those of you who don't know, she represents our State Senate District number 28 and covers Catron, Grant, and Socorro counties. She's been an educator, though, for 25 years, and this is something I'm not sure if you all know, but she's not just an educator in terms of working in her past as a teacher, but also a school psychologist, and has been a director also of special education. She really pursued her career because of her son, Nicholas, who was born with a rare genetic syndrome. And in addition to her role as being a senator, she's also working in the Cobre Consolidated School Districts, the Aldo Leopold Charter School District, and she trains teachers on how to deal with trauma-informed care in terms of teaching practices, which is something I think our teachers are experiencing every day now more and more. So Senator, I want to go ahead and turn it over to you for some opening remarks to help set the stage as we begin this discussion and have an opportunity then to learn from some of our presenters today. So Senator, go ahead.
Thank you, Carolyn. It's an honor to be here with all of you this Monday morning. Like Carolyn said, I serve Senate District 28, which includes Grant County, Catron County, and most of Socorro County, where my family's lived for hundreds of years here in New Mexico. So it's just a great honor to be able to serve this part of the state. And I just did finish up my 28th year in education. I started out as a kindergarten teacher back in 1994. I received my master's in school psychology a few years later and worked as a school psychologist for many years and also a special education director. And I was inspired to run for office back in 2018. Howie Morales was the current state senator for this area, and he came to Aldo Leopold Charter School, where I was the special ed director, and was just talking about the upcoming legislative session and some of the policy goals that they were going to have for the upcoming session. And I raised my hand when he was there talking to all of us teachers and administrators. And I asked him when we were going to get more support in the schools for mental well-being, because every single morning outside of my office, I would have a line of students out there who were in emotional crisis. So I was wearing two hats. I was the special ed director as well as the school psychologist for the charter school. And I just saw that children were just in emotional crisis more and more frequently. And it was really alarming because I had been in the school since 1994 and was really seeing an increase of these concerning behaviors in children who were self-harming. So I knew there was something going on. But really my passion for learning more about mental health and mental well-being started about 22 years ago. Like Carolyn said, I had a son who was born with a rare genetic syndrome called Rothman-Thompson syndrome. It's an autosomal recessive trait. And we knew that he was susceptible for developing bone cancer or osteosarcoma, which he did receive a diagnosis for when he was 4 years old. So it was 2000, I guess the summer of 2000, and we received that diagnosis. He did have osteosarcoma. He required a year of chemotherapy, 18 different courses of chemotherapy, in addition to a left leg amputation. And the trauma of that year that I experienced, that my son experienced, and really the whole family experienced, trying to get him through these medical crises and all of these surgeries that he needed, really highlighted just how impactful traumatic situations, whether you have control over them or not, if it's an environmental thing, a medical thing, it really affects the way that our brains process information. Our brains are flooded with cortisol, which negatively impacts learning and memory. And so I really wanted to learn more about how we can undo some of the damage that trauma causes. And so I went to a Challenging Child Conference every year at Western New Mexico University. They would host a Challenging Child Conference where they would talk about strategies for addressing challenging behaviors in the classroom and in our homes. And this particular Challenging Child Conference, they talked about the brain chemistry that's released during times of trauma, during times where we don't feel connected to either our peer group or our families, and how we can really optimize how we respond to children. We can create the kind of brain that can more easily be in our prefrontal cortex, where we respond to situations instead of reacting. And so this was really life-changing information for me. So I'm just going to give you a rundown really quickly so you have the information. It was information that I had heard in my master's level classes, but it wasn't until it was paired with the visuals that it really made sense to me, and I could see how it would impact me as a school psychologist and allow me to really have some concrete skills to be able to share with educators. And it became this foundation of training that that I now use with educators, go into the schools and do these trainings, as well as practices that I use with children that are on my caseload, as well as my own kids. I have 4 kids of my own, ranging from 29 all the way to 9. And so these are strategies I use with my own children as well. But so we have 3 basic brain stages when we're responding to social conflict. And when we feel unsafe, we're in our lowest brain state, and that's the survival state. And we have limited skill set here in our survival state. It's way back here, you know, fight, flight, surrender. We've all heard those about that part of the brain. When we don't feel safe, we are reacting in a social situation in an unconscious way. And we have a limited skill set there. And so unless our safety needs are met, we're in that lowest brain state. And then our next brain state that we have available to us when we're solving a social conflict is our limbic system, where our emotional centers are. And the developmental question there is, am I loved? Am I connected? Do people in this room care about me? Does my family care about me? Am I valued? And if we don't have that developmental question answered, then we're stuck in those lower brain states where we're reacting in an unconscious way. If we have our safety needs met, if we have our connection needs met in our limbic system, that's when we can access our prefrontal lobe, where we can choose how to respond. So ideally, we would all be up here in our highest brain state. And when we are connecting with each other, whether we're adolescents or we're babies or we're adults, we release oxytocin in our limbic system. And that's what opens up the myelination process to our prefrontal lobe, where we can have a stronger pathway. When we get triggered into a lower brain state, we're able to come back up, choose a self-regulation method, or connect with somebody we care about and come up to our prefrontal lobe, where we can choose how to respond. And so my whole life goal was to help to educate parents and educate educators, other educators, so that we all know what kind of foundation we need in our schools and our communities, so that our children and our students can have those developmental needs met. And so just a few ideas that can really go a long way in having those basic needs met, so that we're more likely to be in our prefrontal lobe, is having more predictability. And so when we had the pandemic, all of our ability to predict what was going to happen in the future was out the window. We saw rituals like graduation and weddings and funerals, those times that we come together and share this collective joy or collective grief. We didn't have that anymore, and there was no certainty. We had school shut down, and so kids weren't able to build those social connections that we need for healthy brains. And so in order to release that oxytocin in our limbic system, and in order for us to help children release that oxytocin in their brains to build really healthy brains and build those connections to our prefrontal lobe, we have to have eye contact, we have to have touch, we have to have presence, and we have to have a playful interaction. And the more of that we can incorporate in our schools and our community, the healthier our brains are going to be. And when we're doing Zooms like this, I mean, it's really been beneficial because it gives us that flexibility to meet even though we're in a pandemic, but it's not ideal for releasing all of those happy brain chemicals. It's more exhausting, you know, when we spend time on Zoom, we don't really feel the same way that we do when we're meeting in person. So the more opportunities we can give our youth to spend time in person and connect and to have that playfulness, it's going to go a long way in healing some of the trauma that we've all experienced throughout the pandemic. And I'll give you just an example of once I learned these skills and I was able to go into the schools and model some of these behaviors or some of these strategies working with children, it was so empowering to me because I really felt like for the first time as a school psychologist, I had some really helpful skills to be able to share with the students that I was working with. That was beyond just, you know, treasure chest and stickers and things like that, because when you're dealing with a child who comes from trauma, there's no sticker, there's no name on the board, there's no threat of losing recess that's going to help that child learn how to manage big emotions or learn how to manage their anger. And I had been working with this student, he was about 7 years old, and all of the other school psychologists had just refused to work with him because he was so aggressive, so physically aggressive. And I was trying to build rapport with him, but it really wasn't going anywhere. He was a very, very angry child. You could tell he must have come from just, you know, terrible trauma and feeling disconnected from his family, from his school family, and from his peer group. And so we were out on the playground, and I was looking for some behavior that I could notice and compliment for him, because I learned that what you focus on, you get more of. So I wanted to focus on something that I saw him doing that I wanted to see him repeat. And it was kind of tough because he was a tough kid. So, but eventually I saw him just out on the playground, beautiful grass playground, and he started pulling some weeds in an area. And I went up to him, we'll just call him Joe for today. And I said, Joe, you are over here, you're pulling all these weeds to help the grass grow. That is so helpful. And his little eyes sparkled, and he looked at me with the biggest grin. And he went out there even more enthusiastically and started pulling all these weeds and showing them to all the adults on the playground, saying, look at what I'm doing, look at what I'm doing, helping the grass grow. And afterwards, we were walking back to the classroom, and he ran over to me and he grabbed my hand. And he looked up at me and he says, why did you say those nice things to me? No one has ever said anything nice to me. And it just brought tears to my eyes, because I was having one of those really challenging years too. I had this supervisor who was really kind of a micromanager, and I wasn't feeling super connected with my coworkers either. And we just had this amazing moment. And I just thought, this is magic. I felt so much better instead of scolding him throughout recess and telling him, don't do that, go over here, stop hitting him. It was so much more, it was a much more positive way for me to spend my time with him, and clearly made a big impression on him as well. And here I am, like over 10 years later, and still sharing that story because it was so powerful, and really set the stage for how important it is that we all learn the skills, whether we're parents, educators, or just people in the community. We learn the skills how to maximize our time when we connect with each and every person in our community, making eye contact, asking them how they're doing, and what a powerful thing that can be. And so I've really spent a lot of time looking at how can we as legislators focus on policy that's going to make sure that we're building our communities, building our schools on that foundation of safety and connection. So one of the things that I was proud to have been able to help with is the beginning of this school year, they were going to have an active shooter drill as a beginning of the year meeting at Silver Schools in Cobury. And I just thought, let's bring in some motivational speakers and just show our gratitude for our teachers, for our staff. Additionally, share some of this information about how they can set up their classrooms to make sure that they're meeting those basic needs of their students also every day. And so we had over 600 local educators from all the schools come meet collectively at Western New Mexico University at the Fine Arts. We had two amazing speakers come in. One of them, Alvin Laws from Saskatchewan. He's a motivational speaker who was inducted into the Canadian Hall of Fame. And he was a thalidomide baby, born without arms. And my son, Nicholas, who had to have his left leg amputated, he was also born without thumbs and some other bone anomalies. He was able to help me introduce Alvin Laws, and that was a really special moment. And we also brought in a conscious discipline instructor. Conscious discipline is a social emotional behavior program that's evidence-based, that it's really teaching educators the skills they need to make sure that their children, their students, have their safety and connection needs met, so that they're more likely to be up in their prefrontal lobe, where learning really can happen at a much easier, more efficient way. And so those two speakers came in, they spoke with our local educators, and we had several sponsors who helped to pay for lunch and breakfast. And it was a really positive way of all of our educators starting the school year. And lots of people reached out afterwards and said how much they appreciated that. But I think that we need to not forget how this has affected educators as well, and make sure that their mental well-being is being supported as well, because this has been tough for all of us. And if we can all move forward in a unified way, recognizing that we all need to have those safety needs met, we all need to feel connected and valuable, like we're contributing in a meaningful way to our community. And in addition to that, making sure that we're prioritizing funding for mental health, and making sure that we're addressing and dealing with the lack of providers. So whatever we could do to make sure we're increasing provider rates and other strategies to make sure we're increasing our mental health infrastructure here in New Mexico. And minimally, also making sure that everyone has their basic needs met, like housing and access to healthy food and safe water, safe drinking water, and behavioral mental health services and healthcare services, so that then we're able to move up to other important learning processes. So in closing, I just want to say that I'm not here to have all the solutions or to be right and tell everyone how we need to do this, but I'm here to get it right by listening to stories and listening to providers and coming up with solutions together that are evidence-based and that other states have been able to implement to really be successful in their states addressing these very serious issues of mental well-being for children.
Thank you so much, Senator. And you raised some really good points that I know our panelists are going to want to talk a little bit more about this afternoon as well, in terms of how we fund mental health and access to care, and all of those experiences that our youth are going through right now. Megan, I want to go ahead and turn it over to you to moderate our panel for today. And for folks who don't know, Megan Kamerick is on with us today. She's been a journalist for over 25 years and worked at different business weeklies in both Texas and in New Orleans before coming to Albuquerque. She started off really as a phone volunteer with KUNM, but now she is the news director for KUNM, and she's hosted lots of different shows there at KUNM, but also on PBS, mm-hmm. and currently is also hosting cannabis, growing forward cannabis with New Mexico with Andy Lyman, which is a very popular podcast that we've got going on in our state. So Megan, I want to turn it over to you to introduce some of our panelists and also get that chat going and conversation with what some of their experiences have been.
Exactly. Thank you, Carolyn. As the pandemic has made very clear, mental health among our young people is in crisis, but it began years before the pandemic. I'm grateful I can be part of guiding this discussion today as we think about solutions. Thanks to Molina Healthcare of New Mexico, along with Molina Cares Accord, for bringing together today's expert panelists. Leslie Kelly is the Behavioral Health Coordinator for the New Mexico Public Education Department and Coordinator for Social and Emotional Learning Programs. She's been an educator, counselor, and behavioral health specialist in New Mexico for over 30 years and is a strong supporter of whole child education and social and emotional learning as the pathway toward equity, access, and success in education for all students and adults. She holds a BS degree in special education from St. Cloud State University in Minnesota and an MS in counseling from Adams State University in Colorado. Cathy Schueler is the owner and founder of Bosque Mental Health Associates. Her background includes over 35 years of experience as a therapist, university instructor, and CEO of Bosque Mental Health and Parenting Forward, LLC. She began her career as an art therapist and clinical social worker, working in a variety of settings, and quickly recognized the toll taken on those who serve others in emotional distress. She designed Bosque Mental Health as a place that takes care of the needs of therapists first. She lives in Albuquerque. And Gabrielle Dietrich is the executive director of NAMI, New Mexico, and the co-founder and conductor of El Faro Youth Chorus. It's the first ever trauma-informed choral ensemble. Her personal experience with singing as a powerful means of self-expression, a vehicle for building social skills and healthy friendships, and a catalyst for healing the effects of trauma, as well as her work with underserved youth, have led Gabrielle to her operations for the state arm of NAMI. It's the largest grassroots, I'm sorry, I skipped a line. Her current work in the mental health space. In her role at NAMI, New Mexico, she oversees all daily operations for the state arm of NAMI. It's the largest grassroots mental health organization in the US. And it has local affiliates in Farmington, Santa Fe, Albuquerque, and Las Cruces that offer free support groups and educational programs for individuals living with mental health conditions and their families. As you alluded to, there was a national report by Child Trends using data that shows New Mexico has some of the highest rates of children suffering from adverse childhood experiences in ACEs. These are traumatic childhood events. They can follow a child for life and contribute to chronic health issues such as alcoholism, drug abuse, and suicide. It's critical that we develop innovative and bold solutions for adolescent behavioral health in New Mexico. Consider this from the CDC. A report on mental health in youth during the pandemic indicates that overall children's mental health and well-being was negatively impacted by COVID-19. Emergency room visits for mental health related problems rose sharply in March 2020 at the beginning of the pandemic for both young children between the ages of 5 to 11, as well as teenagers. Girls in particular suffered. During the pandemic, female children experienced a higher prevalence of parental and personal job loss, emotional abuse by a parent, and difficulty completing schoolwork when compared to male students. That's according to the CDC. Leslie, I want to turn to you. Throughout the pandemic, what kind of behavioral health issues have you seen among our adolescents? And what is the state of adolescent behavioral health at this moment?
Thanks, Megan. I really appreciate this opportunity. I think Senator Hemphill really said it all. You know, we do not have current statistics because it takes a while to collect and report. But earlier, Carolyn mentioned about 40% of high school students feeling sad or hopelessness. That was from 2019. We know that those feelings increased in the body of adolescents that feel those increased. And that's up. That was up from 2009, where only 29.7% of high school students reported feeling hopelessness or sadness. And same is true for experiencing major depressive episodes. Those numbers are up. They're up prior to the pandemic. So we know we're going to see much higher numbers post-pandemic. And what we're seeing in schools is what Senator Hemphill alluded to. We're seeing kids coming back after the pandemic, experiencing isolation, experiencing lack of connection, disruption of their daily activities, grief and loss for what happened, not just if they lost loved ones or friends, but grief or loss of a school year, grief or loss of a graduation, grief or loss of all of those things. And the ambiguity, which really, research shows that all these stressors cause us to focus on negatives, and it causes us to perceive more threats, and those lead to more problems with depression and mental health issues. So our kids are suffering, and I appreciate Senator Hemphill talking about our adults, because our kids are in the care of the adults, and they've had similar experiences. So in schools, we're seeing well, there was that whole TikTok thing where there was a lot more violent behavior. Kids are very dysregulated, and so then they choose to behave in ways, or they don't have a choice to behave in ways that are not positive solutions or not positive behaviors in schools. So we really need to work on supporting the regulation of our staff, students, communities, and get people back to a state where they can actually have relationships and can learn.
Yeah, the influence of social media is profound. I can't even imagine going through that again as a teenager. Cathy, today's youth are struggling mentally, especially with the impact of COVID, social isolation, bullying, other outside factors we've touched on here. You also deal with children who may have difficult home and family lives. What are some of the ways we can support kids struggling with their behavioral health?
Yes, well, thank you very much for having me on this panel. I really appreciate everything Senator Hemphill and Leslie have said thus far about what it is that's happening with our youth. I'd like to start by just saying that one of the things I did in preparation for this panel was that I contacted a sample of PhD and master level therapists, 7 to be exact, who work with adolescents for their impressions over the past couple of years, to understand a little more about what they're seeing on the front lines, because I'm, as the director of Bosque Mental Health, I'm not directly seeing clients anymore. And one of the things that they said that was very important, I think, is that if there's a need to normalize mental health. We all have it, good or bad. It's something that we have to deal with. And it's something that I think over the course of the pandemic, everyone has been recognizing more. We certainly have seen a huge uptick in people calling us, trying to get in, to have their children in, to have their families in, to just deal with all of the things that have been talked about thus far. And one of the ways that this could happen, I believe, is if we are able to speak more openly in public venues about what's happening with mental health. There are institutions where this could happen. All of our institutions, like schools, churches, media facilities, clear down to within families and among friends, where people can speak more about what's happening. How do they do this? Well, there is a technique out there that one of the therapists I spoke to said she uses on a regular basis. It's called QPR, and it's something that everyone can learn. It's QPR stands for question, persuade, and refer. And just as everyone knows what CPR is, which is medical emergency intervention for heart attacks, QPR is a mental health emergency intervention that's very simple to learn about. And it would be wonderful if we could have everyone learning, just as they learn CPR, learn QPR. This could be trained universally, and CPR is certainly a great model for how to do that. What I think it's important to remember that just because a kid looks and acts okay, it's important to ask questions about suicide. Actually, if someone learns the symptoms or the signs of suicide, if children are asked about it directly, they're more likely to say something. I know it's not a comfortable question to ask, but it needs to be asked to help make sure that we are all in the know of what's going on with children, and we can react and respond and take care of them. QPR is an easy thing to learn and practice, and to know what the signs and symptoms are for what to ask. Another tool that I think is really important is the new national suicide hotline, which is, the number is 988. And that's something that if you know someone, or someone comes to you and says something, calling 988 is a great first response, and it should become as familiar to people as 911. It's another thing like CPR. 911, 988 is the mental health hotline. And the reason we need community involvement from top down to bottom level, friends and family, is because adolescents are savvy and they know their privacy might be compromised if they speak to some official person about what's going on in their life. So for friends and family to know how to ask the right questions, it's really an important thing. One of the therapists I spoke to talked about how she had spoken to the parents of a child and the parents denied that their child was suicidal. They said, that is not so with my child. Yet the child had told them, I'm feeling suicidal. Yeah, when you ask me that question, yes, I am feeling suicidal. So to speak to parents who deny this, it's really important that we get information out to parents so that they know how to accept information like this, information that's not a happy bit of conversation to have with anyone. But it's good to know what questions to ask. And that's mainly what I'd like to say about that.
Thank you so much. Appreciate it. Gabrielle, we know mental health challenges are nothing new, but the pandemic has contributed to a greater awareness of these issues and the need for services to respond to them. There's still a stigma around getting help for behavioral health. How can we identify when our youth may be dealing with these issues and help them overcome that stigma?
This is a really interesting and important question. And I think one of the reasons why that it's so important is that young people can be emotionally tumultuous no matter what. That's the stereotype, right? And so how do you discern when somebody is in distress and needs an intervention from when they're going through a normal childhood or adolescent kind of an incident? And it's really for a clinician to decide, when something is pathological versus when something isn't. But as a person who might be a trusted adult, or who might be the person who just happens to notice what's going on, the kinds of determining factors are frequency, how much of the time is this happening, duration, how long has it been going on, how bad is it, severity is also a really important way to kind of make a determination about, is this a moment to intervene, or is this person just having a bad day? If a person, if you know this individual has had a traumatic event, if a parent has died, if their parent's going through a divorce, if you have knowledge about the context, that'd be a really good reason to ask. If you see a kid not eating, if you see a kid's hygiene start to suffer, these are moments to immediately intervene. And also extreme isolation, if they're not hanging around with other kids that they used to hang around with, if they're not interested in the kinds of activities they used to be interested in, these are things that any person could notice and act on. So those kinds of behavioral signs, you don't have to be an expert to see those, to notice that somebody's sad, that somebody's expressing that they're not feeling right, and to respond to it. And the second half of your question about stigma, NAMI talks a lot about stigma. It's one of our main kinds of it's one of the main things that we talk about in this organization. And I think we have to, for young people, model destigmatizing language. We have to teach the difference between saying, oh, she's bipolar, versus, oh, this person suffers from bipolar disorder. You have to put the person first. And if you model that yourself, then young people are going to start to think, oh, this person's an individual. This isn't a walking disease. If you have a disease, that isn't your whole identity. It's just something that's happening to you, and it can be treated. I also think it's important to be open with young people about your own mental health struggles in an age-appropriate way. Obviously, you don't want to overshare with a child who's developmentally not in the place to handle things, but I think it's okay to say to an adolescent, I've felt depressed, or I've felt anxious. And by doing that, you kind of blaze the trail. You make it okay for them to also have the same struggle. I also think it's really important to ask open-ended questions and believe them when they say the answer. I think that story that Cathy told is so moving, that you have a young person who knows what's going on inside of them, and parents who are so upset by that reality that they just push it to the side. And that's a human response. Denial is a human response, but it's a dangerous one. And so we have to learn to take young people at their word. I think that that's extremely important. I also would say that any adult would benefit from reading books about emotional expression. Brene Brown has a new book called Atlas of the Heart that talks about labeling emotions accurately. And there's a special actually on HBO Max, I think, that my husband and I watched together, and just found it really, really interesting, this idea that you would label your own emotions, and by doing that yourself, you free other people up to do the same. NAMI also has a lot of wonderful resources that are free to everyone. NAMI Basics is a course that's specifically for caretakers of young people. So there's a lot out there and a lot available. And QPR is a fantastic program. Mental Health First Aid is another one that anybody can take and then feel a little bit more prepared to have that conversation.
Great. Thank you so much, Gabrielle. In June, the U.S. Congress passed the Bipartisan Safer Communities Act of 2022 in response to the school shooting in Uvalde, Texas. The act that was signed into law will, among other things, allocate $11 billion for mental health services. That includes grants to increase school-based mental health services. Leslie, I want to turn back to you. Will you be taking advantage of these grants at PED? If so, how will this expand the work you're already doing to support youth in New Mexico schools?
Yeah, for sure. At this time, we don't know how much money the state of New Mexico is going to get, or the PED specifically, but we will definitely use federal dollars to our advantage. As we did during the pandemic, there was a lot of federal money that came our state's way that we used exclusively, some of it exclusively for mental health supports and social emotional learning supports in schools. We currently have two federal grants. That one is to help support the development of school-based mental health workers, and the other one is looking at supporting mental health systems in schools, from prevention to intervention, providing a lot of different support there, from identification to getting students to see a therapist. And I did want to say that right now, I actually made a proposal to have, and it's not approved, but it's something that we're talking about at PED, because all staff have to take, are required to take a class in child abuse and neglect because they're mandated reporters. And eventually we'd really like to see all staff have to take a QPR course. They're very inexpensive. They're very easy. We have done a lot of trainings in partnership with the Department of Health around the state, teaching QPR to adults, to students, youth mental health first aid. It's key because, and I know I went off topic a little, because one of the best practices for suicide prevention is training the entire community. Because as I think, I can't remember if Gabrielle or Cathy said it, the kids know what's going on with each other way before we do. And by the time we notice it, it's usually it's not too late, but it's very late in the process. And so intervening early is really important. And so giving other people in those kids' lives the tools to ask the right questions and to understand signs and symptoms is really important. But yeah, as soon as we know how much money the state is going to get, I know that we will be partaking in it. And I know that some of it's going to come in the form of Title IV, which is what we already receive. It's called SSAE. It's Student Support and Academic Enrichments, and all the schools get grants in varying amounts around that. And it's not just for academic support, because if students aren't ready to learn, we can't really provide them academic support. So a lot of it is around giving schools and districts the ability to hire support personnel, counselors, social workers, and then also activities that support social emotional learning.
Oh, that sounds great. Well, I'm looking forward to hearing as that money comes to the state. Let's hope for that. We know that teens may be marginalized and overlooked, especially those who are homeless, disabled, or identify LGBTQ+. In your practice, Cathy, are you seeing the impact of mental health issues in some of these groups? And what are some of the specific considerations in how you work with these groups?
Oh, absolutely. Yes, we are seeing more impact, especially during the pandemic. At Bosque Mental Health, we specialize in working with the transgender population. We're very GLBTQ plus friendly, and we see a lot of people who fall into that category, into that group. They are at the top of every bad list and at the bottom of every good list. And the transgender population in particular, they're at the very bottom of the lists and the very top of the list, and in the wrong direction. So it's important that people know what happens, what the resources are that are available out there for all of these various populations who are marginalized. And one of the things I would suggest is to have a list available. Who are the good providers out there? And I say that because there are many unhelpful medical providers who work with these populations, especially with transgender population. And it's important to know who the helpful ones are. And we've been very fortunate because our group who come to see us tell us who these people are, and they tell us who they aren't. So it's helpful to know. And it's hard to get that information. I'm happy to pass that information along to anyone who would like to hear about it. But, one of the things that's important to do with every one of our clients is we listen and we validate. And we may not always get our pronouns right. And there's no need to fall over yourself and make yourself feel make them feel uncomfortable because you're using the wrong pronoun and you feel really horrible about it, because then it places the burden on them to take care of you. That's not what we're after. We want to make sure that they know that we're here for them, and you just kind of apologize and move on. And they're very grateful for that. And that's something we need to be grateful back to them for. We need to express gratitude and let them know how much we care. So one of the things that I'd also like to share here is another tool that I'm sure everyone probably on this panel and everyone listening knows about. It's called the PHQ-9. And what it is it's an easy 9-question scale that evaluates the severity of depression. One of the therapists I spoke to said that it's very important for the medical community, especially those who I was referring to who may not quite know what to do with a trans population, a trans person, to use the PHQ-9 just as a way of gauging what's happening in the medical field. When an intake is done, when someone comes in, often the first time someone in the trans population goes in is because they have a medical emergency and they need to be seen, and they're seen here for the first time, and they can then be given the PHQ-9 to help the medical person understand what it is, how severe the depression is, what's going on, and then refer to those lists of people. But blending the medical and the mental health in every medical facility at intake, I think, is a very important thing to do. And so that's one of the things that I wanted to just see if we can find a way to make that happen.
Yeah, we should be doing that in general, right? Coordinating
Yes.
healthcare. Yeah. Thank you so much. Gabrielle, I wanted to ask you, your bio mentions being the conductor of the first ever trauma-informed choral ensemble. Can you talk about how this program is using music to help kids heal?
I am so thrilled to have the opportunity to talk about this project. It is truly my heart's joy. And we started in October of 2021. It was kind of a case of serendipity, I guess you could say. The conductor of a local auditioned chorus, Coro Lukes, needed a youth chorus for a piece of music he was doing. And I wanted to start a trauma-informed youth chorus, and we went to coffee with the objective of asking the other to do the opposite thing. So it really was this this moment where like-minded folks came together to do something that I want to be very meaningful, and I see on the faces and hear from my students that it is meaningful to them. Music and choral singing in particular has a lot of protective factors kind of embedded into itself. So we have the social aspect of choral music where people are coming together and they're moving together and they're breathing together. And this just together aspect in itself helps people come to a place of calm and come to a place of what we would call co-regulation. So even if I'm not feeling so good today, I'm with you and you're okay. And so I kind of adjust in that direction, which is a pretty magical thing when you think about it. It's sort of like group okayness as opposed to even when you yourself can't be okay all by yourself. The trauma-informed angle has a lot to do with how behaviors are handled in the classroom. The idea is that when somebody acts in a way that is maybe disruptive or that seems off, the question that we ask ourselves is not, oh, what's wrong with you? Stop doing that. But instead, why is this happening? What is creating this situation? And making space for people to be themselves, understanding that people come into the rehearsal, people come into whatever environment they're in, bringing with them all of their experiences and all of themselves. And so it's really important in our environment to think about that. And in addition to the sort of co-regulative and sort of physical aspects of music making, you also have the storytelling and the expressive aspects of music making. Using your face to tell the story of the music in itself can also be something that changes the way people feel on the inside. When you move your face in a way that mirrors what another person's face is doing, you increase your connectedness to them. And you, again, it's this co-regulative thing. I really am so excited for the work that we're doing together. I'm really excited that the UNM Brain and Behavioral Health Institute is going to do some research with us. We're going to work together to try to really evaluate what the program is doing for the young people who participate in it. And we're also really excited about doing some work to get students transported to the rehearsal site so that we can reach the folks who need it the very most.
That sounds great. I think you need one for adults, right? I mean, is that the next step?
You got it.
Thank you so much. So we've discussed how the pandemic has impacted adolescent behavioral health and some of the solutions and best practices that have been implemented to respond to the crisis, but it's important that all the stakeholders are part of this discussion. What can providers, policymakers, other sectors of the healthcare field do to support our children and help them overcome behavioral health issues? I will say we just had a comment from someone in our audience. Samantha said, we utilize PHQ-9, the adolescent version, at UNMH and all pediatric primary care clinics now, and we have seen great success with it in identifying patients who need support. Leslie, I'll go to you. What would you like to see?
I'm told I need to be fast, so I'm going to say a lot. So we need to invest in prevention. The most amount of our money goes to intervention. We have to take care of those people, but they're the minority. And so we really need to look at the things that Senator Hemphill talked about at the beginning. How do we create schools that are safe and supportive? And how do we make relationships the most important thing, because then learning can occur. So I'm not going to talk, I just wanted to refer to Dr. Bruce Perry, and if anybody's not familiar, look him up. He talks about this neurosequential model, a lot like Senator Hemphill was saying, that we get these kids come to us with all these traumatic experiences or a traumatic experience that's been going on for a long time. They're dysregulated, so they can't learn until they're regulated. They can't relate to us until they're regulated. They can't reason until they're regulated. So anyway, I just want to say that. And we need to invest in behavioral health in schools, clinical people that can come into schools. We need to transform education to meet the times and really provide professional development and support for our teachers, because we're asking them to do more and more and more. And they are having this experience as well as the kids in their classrooms. So anytime we can focus on protective factors, anytime we can use evidence-based practices. And then the most important is, I think we need to give adolescents a true voice in policy change. And find out how they can offer us some best methods to overcome some of these issues. They're living it. And when I say true voice, we need to bring them to the table so they actually can participate, and then we do something with what they tell us.
Quick comment from Susan Chacon. NMDOH Maternal Child Health Title DO program is a new Title V program, is a new grantee in HRSA's Pediatric Mental Health Access Program to support pediatric providers around behavioral health. They're rolling this out. We'll also be receiving some AMRP funding this month to support schools and emergency departments, hoping to better support the infrastructure. Cathy, want to go to you. What would you like to see? Also, we did have a quick question from Felicia. What about if a child won't say anything to someone who's different than them and won't talk to anyone than their family or in their own culture?
That's a really tough question to answer. The individuals, the adults in the room have to figure out who does this child talk to, who are they willing to speak with, and it may be someone you don't even know, but I would say as a quick answer, it's a nickel version of that answer, but find who the child will talk to, who listen for cues for who they might be interested in speaking with. And to answer that question about policymakers, one of the things that I would like to say, I appreciate Leslie saying that about getting mental health professionals into the schools. One of the licenses that has been ignored in the schools or is not yet, I should say, able to participate in schools as school counselors are art therapists. Art therapists are amazing at tapping into the creativity of children and youth. And like Gabrielle was talking about with music, art and creativity, kids are so down with that. They're ready. They want to participate in this way. And who better to help them than an art therapist who's trained in mental health and art.
That's fantastic. And Gabrielle, what would you like to see?
Mainly, I want to echo Leslie's closing point, which is the idea of listening to the voices of the young people themselves. In NAMI, we talk a lot about lived experience and valuing lived experience. That's true for young people as well. They know what's going on inside themselves. They might not express themselves perfectly, but they know. And so taking them at their word, even if the way that they express themselves doesn't initially make the most sense or seem the most practical, we need to listen to them because they have valuable things to say.
Leslie wanted to let us know there's a school art therapist license via PED. Also, Cathy Salazar said, please remember that age 14 children have the right to agree or disagree with mental health care. And also Samantha said, investing in provider healthcare worker education and training is important, advocating for mandating training in suicide assessment and prevention in the healthcare field. We could talk for at least another hour about this, but this has been an excellent conversation. So thank you all so much for joining us. I will turn it back to Carolyn.
Thank you, Megan. And I want to thank all of our panelists and Senator Hemphill for joining us today. You're right, this is a very important topic, and it sounds like we have a lot more conversation that we need to have offline. So we'll continue to do that. There's a lot of really good comments also in the chat that we'll go back and reflect on and make sure to share things back. So we'll post this publicly. We'll make sure we share it back with everybody who wasn't able to attend today so that they can get the information. And then follow up with folks. If people want to hear more about what the Molina Cares Accord is doing across the nation, but also in New Mexico, you can visit us just simply at molinacares.com and get some of that information. I want to thank everybody again for joining today. What an important topic, Megan, and to our panelists. It sounds like we have some more work in this area to do as we figure out the best ways to fund some of the community efforts that are out there. So thank you so much, everyone. Really appreciate it. Look forward to our next panel.